Hi all, welcome to Nclex Mentor. Today's topic is Epistaxis or nose bleeding. Let's deal with the definition first. That is the loss of blood from the tissue that lines inside the nose. Moving to the causes, we know that the local trauma is one of the cause, and inserting an object means foreign bodies, nose picking, mucosal inflammation, prolonged inhalation of dry air, high altitude, blood thinning drugs such as warfarin, aspirin, colds and sinusitis, blowing nose forcefully, and chemical irritants such as cleaning supplies, and inserting any object that are the causes for this nose bleeding. Move on to the types. Simply we can classify it as anterior and posterior. Other than that, local bleed, systemic bleeds and idiopathic bleed. Regarding the anterior section, bleeding from the frontal part of the nose and the lower part of the wall, and posterior means from the posterior part, that is superior part of the nose. This is a deep inside bleeding from deep. So anterior is the common one and posterior is in complicated cases. Regarding the management, first we have to sit upright the patient. Then in that, lead body and head slightly forward in order to prevent the aspiration. Then mouth breathing, as the patient to breathe through mouth. Hold tissue or washcloth to catch the blood, and pinch the soft part of the nose using thumb and index finger 5 to 10 minutes continuously. It is known to be as the pressure application. And apply ice pack. Where we have to apply the ice pack? In the nose bridge. So apply pressure on the soft part and apply ice pack on the nose bridge. And what about the severe cases? Severe cases in the sense, you cannot stop the bleeding after more than 15 to 20 minutes of applying direct pressure on your nose as described in the steps above. Okay, the bleeding is rapid or the blood loss is large, that is more than a cup. You are having any difficulty of breathing and recurrent nosebleed. You have vomited because you have swallowed a large amount of blood. Your nosebleed has followed a blow to your head or any serious injury. You have to consult the doctor. What about the treatment modalities? It's the first one, which includes nasal packing. These are all medical treatments. So nasal packing, cauterization and medication. Medication in order to stop the bleeding, that is tranexamic acid and foreign body removal. And in case of deviated septum, go for the surgical repair. And ligation as the final procedure, that is the blood vessel is tied off. And regarding the child condition, first we have to keep the child calm and quiet. Have the child sit up and lean forward as we told already. Apply continuous pressure to the nose 10 minutes. Okay. Apply ice or cold cloth to the bridge of the nose. Place cotton or weighted tissue into each nostril. After the bleeding stop, petroleum jelly or water soluble jelly applied to prevent the crusting. Okay, thank you. This was all about the epistaxis. And keynote for this management I will include in shorts.